Okay, let's shift gears into the main topic. So, if you didn't catch the beginning of the show, sorry, I had a stroke there for a second. No,
Senior moment.
yeah, senior
If
moment.
you didn't reset.
If you didn't catch the beginning of the show, there were some changes that have kind of started to be communicated, right, from carriers this week, in the last couple of weeks, that agents are really starting to kind of lose their minds over. And my first reaction was, I was like, why are you losing your mind? This is not new information. So before I kind of decided if we could talk about it or not, I determined that we could, because as long as we didn't mention any carriers by name, because this is public information, right? CMS had put this out on their own accord, on their own platform, their own website, back in December was the earliest public communication I could find in this. I had been hearing about this as far back as basically a year ago. So again, right, I never thought it was a relevant topic, but apparently it is for many of you, because lots of you just, I don't know, you just haven't been paying attention to what's been going on. So I'm going to share my screen and we will jump into this article.
Let's go.
Or announcement, whatever you want to call it, from the Centers for Medicare and Medicaid Services on CMS.gov. Okay, so this was put out December 16th of 2024. Can you see my screen, sir?
Yes, sir, I can.
Okay, so this is what it has to do with. Medicare Advantage Value-Based Insurance Design, VBID model, to end after calendar year 2025. So this will take effect for any plans starting January 1st, 2026. Okay. Excess costs associated with the model unable to be addressed by policy changes. So I'm not going to read this all, especially because it's been put out by CMS, right? It's a kind of a bit of gobbledygook. But I will.
Great for goblins. If you're if you're a compliance goblin, you'll read every word. Read it twice.
Yes, if you are a goblin, as it seems. Okay, so it starts off by saying CMS is terminating the Medicare Advantage Value-Based Insurance Design VBID model at the end of 2025 due to the model's substantial and unmitigable, I can't speak, costs
Unmitigable.
I can't speak English.
I don't know how to say that.
To the Medicare trust funds. Excess costs to the Medicare trust funds of this magnitude, $2.3 billion in calendar year 2021, $2.2 billion in calendar year 2022, associated with the VBID model. Based on the prior and forthcoming evaluation reports, respectively, are unprecedented in CMS Innovation Center models. Additional analysis of model performance and policy options demonstrated that these substantial costs were driven in part by increased risk score growth and Part D expenditures, and that no viable policy modifications could address these excess costs. As such, the model must be terminated at the end of 2025 to meet the CMS Innovation Center's statutory requirements. So basically, what does this mean, right? Again, there's a lot of gobbledygook. So what the VBID model is it's a model that includes benefits to a certain type of benefit on a Medicare Advantage plan, often seen in DSNP plans mostly, right? So an example to this would be a grocery card, right? Okay. A grocery card is falls into this VBID category.
What about, did I see dental benefits are also a part of this too?
We don't have, I don't have all the details in terms of all the specific benefits. It will probably come out more as we go. I haven't seen anything that specifically mention dental. It
may have
might
been like
be.
a comment I was reading where someone was asking, or someone was assuming it included dental, but that would be really interesting if some of these benefits started to get removed from these plans, like dental.
My understanding was it had more to do with, and you see some plans do this now, right? There's some plans that are not chronic SMP plans where there's a health questionnaire to determine eligibility. There are some plans now that you can enroll into, very few, but they might have like a grocery card of some kind. But you can be on the plan, but to use the grocery card benefit, you have to have a qualifying chronic condition. And so,
So is this the end of grocery cards?
no, I don't. It's not the end, but
Less
only a
plans will have them.
segment. Well, no, I'm not even. I don't even know if that's the case. But not everyone will be able to use it. So what I'm saying is the plan might have that benefit, but the only people that can utilize the benefit are people that prove they have a chronic condition and are
Gotcha.
eligible to use it. If that makes sense.
And before anyone could use it.
On a DSNP plan, for example, right? A DSNP
Yeah.
plan might have a grocery card. And if it did have a grocery card, anybody on the plan could use it. The only criteria for eligibility was being dual eligible, Medicare and Medicaid.
Yeah.
And so that's kind of the big change. Again, this doesn't really tell us every exact benefit that's going to classify. But here's some examples, right? Transportation to medical appointments, healthy and food assistance, so grocery card, things like that. So what I would expect, I haven't seen anything. I could be wrong. I haven't. We don't know everything yet for 2026, so I'm not going to pretend like I know. But I haven't seen anything to make me think that that dental, vision, hearing, or things like that will be impacted. But I do think some of these extra, overinflated benefits that, like the Joe Namath commercials and the celebrity commercials
Right.
really sold on their
yeah.
services on, right? Like get grocery cards, to get transportation to doctor's appointments, right? Like they would really push those.
Don't some have like money cards where they literally get like to pay towards utilities and stuff like that?
Well, that's also the grocery card. So a lot of
Oh,
times they can
yeah.
use it for a grocery
Multiple ways.
benefit, or they could use it for utilities and things like that. So anything that falls into that kind of additional model will probably still be on the plan, but the person will have to prove chronic medical conditions in order to get access to that coverage. So it's a much higher barrier to entry for people to have those benefits on their DSNP plans. So that is pretty big change, especially for the DSNP market. One thing I said publicly, because I saw somebody post about this in the Facebook group, I kind of decided to chime in a little bit. I said, I'm so happy that I was right all these years not to focus on DSNP business.
Oh my gosh. Yes.
You know what I mean? Like again and again and again, it just turns out that I'm correct when I've said things over the years.
Prophet. Marcus Lemonis, move over. There's a new prophet.
Once again, I called it right. I'm Babe Ruth, calling my shot. And we lost half the audience. No, but
and they're gone.
No, but I always said that, right? For a multitude of reasons, I didn't like to prioritize dual business. And there's a lot of people that built their agency on the back of dual business because it was one of those things that, for one, right, it was an opportunity to participate in year-round enrollments, right? So they're like, yeah, year-round AEP, blah, 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 basically is kind of what their thought process was. But my argument was always, these plans, first off, the clientele on average, not saying there's not exceptions, but the clientele on average, I feel, is just not really a desirable clientele oftentimes. They're overly needy. You get a lot of
Switch
people that
more
are
often.
fairly entitled. I
Yeah.
kind of coined the phrase "they'll change for a cookie."
You coined it.
I'm the first person that
You,
said it. I guarantee it. I'd never heard
we have
anyone
a
say it until I
trademark
did.
pending on they'll move for a cookie.
But
Let me
I
let me
had,
let me ask you something. Let me ask you
yeah.
something. Do you think this will actually cause a reduction in marketing these benefits, even though they're technically harder to qualify for? Or do you think the marketing is going to continue to push forward and it almost creates this whole other problem where a senior might get signed up for a plan, believe that they can get a card or a food card, whatever benefit we're talking about, and then they get told, sorry, you don't actually qualify for that benefit. Well, my agent told me it was on this plan. Well, and the carrier's like, well, it is on this plan, but you just don't qualify for it on this plan.
So I think we've already seen a pretty dramatic reduction in marketing these benefits because CMS has more provided more clarity over the years on what institutes as marketing versus educational.